Hello and welcome to Respiratory Medicine. Today, we will be talking about one of the most important and common presenting problem in respiratory diseases, that is cough. Now let's move on to see what the contents of the videos are. So initially we'll be introducing to cough, and then we'll be understanding what actually is a reflex. Then we'll be moving on to the mechanism of cough. After that, we will be looking on towards the flow volume curve, which is taken during cough. And ultimately, we will be looking towards the causes of impaired cough and ending the presentation with a few points to be noted, which are quite important clinically as well. Now, let's start with the introduction. What do you mean by cough? Cough, as we know, is an essential protective reflex of the body. Now, it is essential, but it is manifested as sudden, forceful expiration, largely through mouth and somewhat also through nose. Now, I'd like to focus here because during sneezing, there is sudden forceful expiration. However, the expiration occurs mostly through nose, but during coughing, the expiration occurs mostly through mouth. Now, we know that cough is an essential protective reflex. However, both the excessive and weak cough can be disastrous because excessive cough, as we know, might lead to many complications. Now, the most relevant example in this present situation of COVID infection or present situation of COVID-19 is social distancing. And not only that, but the other complications are also there, such as fatigue, fractures, urinary and fecal incontinence, pain in abdomen, and thoracic pain. Now, even weak cough can be disastrous because weak cough will lead to the accumulation of secretion or any kind of foreign object within the airway. Now, that can either lead to collapse of the lung, that is atelectasis, or that will lead to accumulation of organic matter, which will be a quite good substrate for bacterial as well as viral and, if immunocompromised, fungal infections. So now let's move on to understanding what actually is a reflex. Now, reflex is a collection, or we could say it is a summation of all the process that is elicited automatically. So now let's move on. So always for a reflex, we need a stimulus. That stimulus can be mechanical or chemical. Now this stimulus will lead to the activation of receptors. Once the receptors are activated, they will fire on and give the impulse to an afferent nerve. Now this afferent nerve will take the impulse to a reflex center. When the reflex center is stimulated, then that will lead to the firing of efferent nerve. Now, once this efferent nerve is stimulated, that will again lead to activation of effector organs or effector tissues or effector cells, depending upon which reflex it is. And ultimately, this effector organ will do the effect, and that effect will either increase or decrease the stimulus depending upon the type of reflex. See, so this is a basic pathway, or this is a basic plan of how the reflex goes on. So every reflex has these components. So we will be understanding cough on the basis of these components, because as I have said, that cough is an essential reflex of body. So what are the mechanism of cough? What is the mechanism of cough? As moving on, we need a stimulus, and the stimulus for cough can be either mechanical or chemical. Now this stimulus will stimulate the receptors which is present in airway, esophagus, as well as the external auditory meatus. Now after that, these signals pass via afferent nerve. Here in the case of cough, the afferent nerves are cranial number 5, that is trigeminal nerve, cranial nerve number 9, that is glossopharyngeal nerve, and cranial nerve number 10, that is vagus nerve and phrenic nerve. Cranial nerve number 5, trigeminal nerve takes the impulses from nasal cavity and nasopharynx, whereas glossopharyngeal nerve takes the impulses from oropharynx and laryngopharynx. Talking about vagus nerve, it takes the impulses from all of the remaining airway, including larynx, trachea, bronchi, bronchioles, as well as alveoli and lung interstitium, and also esophagus. Whereas phrenic nerve takes the impulses from diaphragm and some part of the liver as well as stomach. Now these takes to the cuff center, which is located into the nucleus tractus solitarius. Once the impulse reaches to this reflex center, then vocal cords adduct. And after the adduction of vocal cord, that will lead to the occlusion of the upper airway. We can see that once the upper airway is closed transiently, all the expiratory muscles contract. Now, once the expiratory muscles start contracting, then a pressure is built up in the thoracic cavity. So this positive intrathoracic pressure can be as high as up to 300 millimeter of mercury. Once this positive intrathoracic pressure is generated, then there is sudden release of laryngeal contraction followed by rapid expiratory flow. That is, the air flows with high velocity. And that is what we know as cough. So this all the process or all the steps that we have explained just now is a mechanism of cough reflex. Now let's talk about flow volume curve during cough. So let's understand what is a flow volume curve. It is just a diagrammatic or graphical representation of spirometric reading in a manner such that x-axis, this as we see here, represents the either expiratory or inspiratory volume depending upon the condition in which it is used, and y-axis represents flow in liter per second. Now we can see that in this case, this flow volume curve is taken during cough, and we can see over here, that initially there is this green line represents just after opening of the laryngeal contraction, that is opening of the glottis, which will lead to rapid expiratory flow. This is initially moving upwards, and this is the flow. And this is the first bout of cough, followed by the second bout, and ultimately these are the subsequent bouts of cough. Now, as we can see here, over here, there is high flow, whereas over here, the flow also decreases, but there is repetitive coughs. So let us hear to the audio to get a better picture of this area. Now this audio will show the cough present in this area, represented as cough. Now we shall talk about causes of impaired cough. So the causes of weak cough can be in any place in the mechanism of cough. I mean to say that in any location in the mechanism of cough, if there is a defect, that will lead to impaired cough. Now let's move. So firstly, talking about the stimulus. If the stimulus itself is abnormal airway secretion. For example, in the case of cystic fibrosis, the mucus secreted is highly viscous so that it does not move on coughing, or it is not cleared completely. That's why it leads to impaired cough. Other causes can be in the afferent as well as efferent nerves. For example, as we can see over here, CNS depression, the condition of anesthesia or coma. When the patient is either anesthetized or comatose, then this cough reflex is impaired because the reflex pathway cannot move forward. Now, when that happens, that will lead to impaired cough reflex, and ultimately anything that goes, any secretion or any vomitus that is inhaled can accumulate in the lungs, leading to aspiration pneumonia. Now, other conditions include tracheobronchomalacia, impaired glottic closure, and tracheostomy. These conditions lead to directly influence the, these conditions directly influence the effector organ, that is tracheobronchomalacia is a condition in which the walls of the airway are so weak that they are often compressed by the surrounding structures and cannot take the pressure that is generated during cough reflex. Impaired glottic closure will lead to will will cause impaired formation of the intrathoracic pressure, and tracheostomy also occurs similarly. Now, talking about the other causes that will lead to indirect effect on the effector organs or effector muscles, as we can say in this case, is decreased respiratory muscle strength, chest wall or abdominal pain, and chest wall deformity. You can note here that I have color coded these so that it matches with the previous slide of dissecting of a reflex. Now we shall talk about few points to be noted. So what are the few points? The first thing, and this first point is quite, we can see it coming in MCQs frequently, and that is Arnold's nerve, which is a branch of vagus, which lies near external auditory meatus, initiates cough reflex on stimulation. That is, cough can occur even due to some irritating mucus or wax plug present in the external auditory meatus sometimes. And when that occurs, that is due to the afferent nerve over that condition is Arnold's nerve. Now, we can see the second point over here. The deep breath preceding cough optimizes the function of expiratory muscle. I will show you what does this mean. See, now this shows what do we mean by a deep breath preceding cough. That means before we take the cough, if we take a deep breath, then it will lead to increase function of the expiratory muscle, and that will lead to effective cough reflex. Now the next, last and the foremost point, important one, that is a series of repetitive cough at lower lung volume, as I have showed there in the previous slide of flow volume curve. The area marked cough, that is the repetitive coughs at a lower lung volume, will sweep the point of maximal expiratory velocity further into lung periphery, which means that further down into the periphery, the substance or secretion or mucus, whatever is stuck there, will come out due to repetitive cough at lower lung volumes. I will show you an example. Notice the pattern of repetitive coughs. So I would like to just share a small thing. That is, I have just changed the color of these 2 points to blue. And this is because these 2 points have important clinical implications. And what are they? Please stay tuned. On to the next video. We shall be talking about the clinical implication of these 2 points. Thank you.